So, good evening, everyone. I'm Dr. Payal, host and founder of Voices of Healthcare. So, welcome you all for the fourth session of Voices of Healthcare. So, today we are thrilled to have Dr. Sundar with us. So, let me just introduce him. Dr. Sundar is a physiotherapist from Chennai with a passion for holistic patient care. And he's going to share his insights on the science and art of exercise prescription. With a strong academic background, he has done his BPT from VELS University and MPT in biomechanics from SRM University. Dr. Sundar has built an impressive career spanning hospitals, clinics, and rehabilitation center. He has taken his expertise to the next level with PG diplomas in nutrition and psychology. And he has treated over 1,000 cases in the past 7 years. As the founder of Move On Health Services, Dr. Sundar is innovating patient care with a unique treatment-based diagnostic methodology currently in the process of patent filing. So he is also making waves as a clinical biomechanist and assistant professor at Navodaya College. And he is the published author of the Green Book. Always on the move, Dr. Sundar is traveling across all over India, inspiring physiotherapy students and professionals alike, and working towards elevating the physiotherapy profession. So let's just welcome Dr. Sundar. So we are very glad to have you.
Good evening, all. Thank you. Thank you so much for your warm welcome.
Over to you.
So, good evening, all the participants. So, my topic is the science and art of exercise prescription. Dr. Sundar and the master. So, I'll tell you one story behind this master. Okay. So, during my college days, I'm one of the worst student. Okay. So, even though I thank Payal for giving me a lot of background, but even though I have some degrees and all, during my college days, I was very, very worst student. So I used to bunk classes. I used to do a lot of the stuffs that this. I'll escape classes, and a lot of professors would hate me like anything for doing this, and I would ask a lot of questions. So I've been doing all these things. Okay. By third year, what happened? I usually practice martial arts. So from childhood, I love this what do you call this Bruce Lee films. So I love a great fan of this Bruce Lee. So I used to watch Bruce Lee films and I used to do on my own and I joined some classes and I've been practicing all those things. So during the third year, what happened means some competition. I just fell down during the competition and I got my hand got a fracture. So my both bones got a fracture in my left hand. Okay, so you can see scars here. So that fracture is a turning point of life. So after the fracture, I went through surgeries. I went through a lot of consultation with other doctors and surgeons and therapists. So literally, what they told me is you can't get your full range. So they told me that it's impossible to get your full range and what do you call it as full power, full strength. You can't weight bear properly like that. They have informed me. So what I felt, I was very bad and was very low, and I don't know what to do. uh, I was feeling like I used to travel, I used to do a lot of things. But for the past 6 months, I've been locked in a room and I'm not able to get off anything off my bed. And I was dependent on everyone. So that's the point I really started to study physiotherapy. So it's not for just academics to recover myself. So that's where I try to take books and try to start it seriously. So by reading everything, so I able to understand a lot of things, and I've met with a lot of physiotherapists also for myself. And so after consulting a lot of physiotherapists, a lot of things, so after rehabilitating a lot, so I able to gain my range of motion fully, full strength. I've got my full strength and full, the past I got back. Okay. So this is possible. This got possible only because of physiotherapy. Because even though the lot of surgeons and a lot of people has told it's not possible to get recovery back. So I recovered back to the physiotherapy only. Okay. So after recovered, I went to the doctor itself and showed all these things. So they literally get shocked actually. So that's how I got into physiotherapy, and that's how I learned the properly, like seriously. And after that, I became as a master. So I completed my full my full martial arts things, and I started to teach others also. So that's why they call me as a master. And my by my story, my friends and my juniors all call me as a master. So that's how they call me as a master, right? So that's a
That's great, sir.
thank you. So nowadays this AI is making lot of stuffs. AI, everywhere AI. Oh my God. So but I'm not into AI. Okay, so I literally I don't hate AI, but depending on that is a problem. So depending on everything. So that's not a that's destroys the human intelligence and human touch and human stuffs. It's destroying the human emotions. So people are fully into AI. So in all my contents, all my classes, all my stuffs, everything. So I'll take my own time. I'll go to library. I'll take a textbooks. Even though I become as a professor, I'll go to library, take my textbooks, and I'll prepare on my own. So in a way, the contents what I've created is completely created by me, and I didn't use any ChatGPT, any Gemini, or whatever the AI stuffs. I didn't use anything. So completely it is done by me. Okay. So I advise some my juniors also. So don't completely dependent on those things. So this AI stuffs will be useful in case of like a software professionals or these engineering professionals. So these professionals, they can do all these things because they are dealing with the damn computer or damn system or damn tools, mechanical tools. So it doesn't have any sense or life. But what we as a medical professional, we are dealing with lives, and it has some human value and human nature in that. So I recommend not that much go behind this AI stuff. Okay, have a mindset to differentiate which is AI, which is not AI, and for examination purpose also make your own notes. It will be hard on you, I can understand, but it has some benefits for that. Okay, so make your own notes, spend your time, and be in a proper way. Don't use this AI. Okay. Yes. How many of you are practicing exercises regularly? It the things about exercises, the other professionals can skip exercises. The other professionals can do exercises whenever they want and they want time. Okay, but as a physiotherapist, you should there is no other way. I'm telling now itself. Okay, so you can't escape. Okay, so try to make a exercises routine, and there is no other way. You have to do exercises, or else you can't survive in your profession, or you can't achieve in your profession. Okay, because that is the only prescription we have. Okay, since how the doctors have their medicines writing up to the clients, so we prescribe only exercises to the clients, right? So without doing exercises by ourselves, how we can prescribe others?
So what you suggest, like strength training should be done, or
Mm,
something different, like
good question, Dr. Payal. No, it's their choice. No. So whatever they want, they can do.
so like I go to the gym for the strength training only because I feel that I might need that.
Go ahead. Go ahead. Do strength training. Do properly. Improve your strength. So go ahead with that. Okay. But some people won't like the gym and strength training. They need kind of endurance training, like jogging, like marathon or sprinting. They love those things. So they can do that. Okay. Some people will love yoga. So I've spoken with a lot of juniors and a lot of physios also. So they put me the question, sir, why sir I'm not able to do it regularly? Why sir I'm not able to continue regularly? That is one of the most commonest questions, like around hundreds or 200 questions asked to me. Okay, so most of the physiotherapists couldn't answer it also. Okay, so after reading psychology one day, able to understand why it is happening. Okay, the reason is that people are trying to fit others template. Okay, so I'm Dr. Sundar now. I've heard your Dr. Payal is telling that the strength training is good, like that she told. Okay. So what I'm gonna force to do means tomorrow morning I should go to gym and do the strength training like her. So my mindset is made like that. So when I try to do means I can do like 2 or 3 days. That's all. Rather there is no possibility. Whatever the motivation video or whatever the motivation song you put, nothing will happen. 2 days, 3 days it will go. Okay. So that is your template. Okay. My template would be mine. seriously, I hate gym. I don't do strength training. So my template is yoga. So yoga, I love kind of yoga and silent things. So like kind of things, Tai Chi. So these and all those my template. Okay. Some other person template, like our participant, one other person will have their own template. They love calisthenics, they love aerobics. So it's their own thing.
So,
Okay.
sir, physiotherapist should do any physical activity to be
Of
right.
course.
It
And
can be.
physio, yeah, and I suggest physiotherapist try it out everything, guys. Try to everything. You wanna prescribe to other people, right? So don't stop with only strength. Try yoga also. Try calisthenics also. Try whatever stuffs. Okay, so lot of stuffs are there available, and lot of plates is available, and plyometrics is available, and lot of numbers there. And try it out everything. So one month, try it out one kind of exercises. 1 month fully you follow that kind of this. So while doing all those things, your body will be trained with different kind of exercises. You will have an idea or different kind of ways to do exercises. And in the process, you won't believe you will also get to know which is suitable for you. You will also able to identify which template you are belongs to. Like how Dr. Payal told, I feel that to do that. So they will also will find out their own thing. Okay. So physiotherapist, I mean future physiotherapist. So there is no point of escaping out and try to do exercises as much as possible. Okay,
Still, I have seen mostly physios don't even know some name of exercises. So, is that
correct.
necessary?
Is that
Like necessary, like जैसे कि कोई exercise prescribe कर रहे हैं and they don't know the name, like for example bridging and
mm,
modification of bridging and all. So they should know the way to do the exercise, or they should know the name also.
they should do the exercises first. They should know the names. Is I don't know what to say. Without knowing the names, how they can treat the clients. So they are not fit for physiotherapy itself. To be very straightforward. So that is one of the basic thing. Even if you don't know how to do means that's a different thing. You don't know name itself, then it's worse then. Okay. So first they need to know the names and they need to practice all those exercises, how it feels, whether it is happening or not, the muscles are recruiting or not. They need to understand first. Then only they can prescribe to others. Okay. So actually in my village, I used to travel a lot. Like so in my village, so there will be traditional practitioners, like traditional medicine practitioners. Okay. So you know what they do means they will pick the client and they consult the client and they will diagnose the client. So after that, they'll prepare their own medicine. So the traditional people, they put these herbs, that herbs, they'll add some water, they'll mix it out, they do some things and all, and they prescribe their, they do their own medicines. After that, they take that medicine. Okay. So in that medicine, just a bit, they open their mouth and put into their mouth first to show the client that it is working, it is safe, it's not poisoned, there is no any issue in that. So first they need to prove that. Then only the public will accept that they'll take. What if then they'll add some poisons and they given to me? What will happen? Right. So after that, they've taken that and they're okay. After that, only the clients believe that they will take that medicine and they will get recovered. Okay. So like in the same way, before we are prescribing exercises, before we are giving beautiful advices, beautiful stuffs to others, first we should know how it is done, how it is happening, what are the things what are the muscles is recruiting. All these things we need to understand. Then only we can prescribe very as per requirement of the client. Right? Clear? Up
Yes,
to
I would like to ask you some questions related to exercise prescription. So, what is the significance of exercise prescription in preventing and managing chronic diseases like diabetes and hypertension?
Mhm.
And also, sir, can you define exercise prescription like for the physiotherapy community?
Yes, so exercise plays a very important role in managing those chronic illness. Okay, so I'll put it in other words. Okay, if you start doing exercises, the chronic illness itself won't occur. Okay, it's not that only after chronic illness or chronic stuff exercise is needed. It's not like that for the chronic conditions, for the chronic issues, we need to prescribe exercises. So if they started doing exercises from start itself, there is no possibility of getting chronic disease itself, including cancer or whatever dreadful disease. Okay. So of course, any chronic illness conditions, exercise is mandatory, and depends upon the conditions, depends upon their capacity. We need to prescribe exercise. So that is where the role of physiotherapist is very significant. It's not like that a template for diabetes, give this exercises. For this condition, give this exercise. It's not like that. We need to assess the patient properly from head to toe, how much their aerobic capacity, how much they can tolerate, how much endurance they can get into, how much repetition they can get into, and what are the interest for their exercises, whether they're able to do this or not, what's their age, whether there is any signs of neurological problem. So those things and all we need to assess. That's our significant role to find the perfect exact exercises which is required for them, which will help to recover from their illness. Right.
Can you define exercise prescription like for Indian context?
Exercise prescription for Indian context. Mm. So from the experience, what I've treated, from the experience, what I've treated with the Indian population, I also do consultation in online. So I've got a client in Germany also, Germany, some and some abroad. 2 3 people are there. So I used to treat with them also. The problem with the Indian context and from the Western context, so the thing is happening is that the Indians are not not any pointing out or saying bad about things. So Indians feel some difficulty in understanding certain exercises, like certain hard exercises, not hard, like difficulty in doing the movements. So the proper way of movements, the Indians are feeling some difficulty than compared to Westerners. So in case of when we treat with Indians, we need to be very precise and we need to demonstrate. We need to properly teach them and we need to touch the patient and we need to properly show the exercises how to. But where in case with other people, we can just say the names and they're able to. Okay. Since because of some tradition and some cultural things, we are not able to perform. So as a physiotherapist, we need to teach them properly, in very slow and very proper way how to do those exercises. Types of exercises. So types of exercises, there are n number of exercises. There are minimum uh, 50 to 60 variety of exercises. Gym, CrossFit, and this badminton, cricket, football, all those things comes under sports. Okay. Sports and swimming. Swimming is one of the amazing things. And the marathon, yoga, so as I told, plyometrics, calisthenics, uh, and each day by each advancement, lot of different exercises are being invented. One of the craziest exercise, like I've been speaking to some abroad people, abroad physiotherapists. I used to have some connection with. So one of the exercises they told me is called as animal flow. Have you heard of that? Animal flow.
Sorry, sir. Animal?
Animal flow.
No, sir.
Have you heard of that? Animal flow. Been recently standardized. So it is the exercises in which we will do the animal movements. So how the animals are moving, so how the joint movements they are performing. We try to imitate that and we will make a circuit of that. So that is called as animal flow. Sounds crazy, right?
Exactly. So is it like cat and camel exercise or something like that?
No,
Oh,
no, no. It's not like that. Cat and camel is just a name.
okay.
So the cat and camel of animal flow will be like a cat. So you need to perform like how the cat will do this, what we call it as thoracic flexion, right?
Oh,
So it will be increased thoracic flexion. You need to, so and there will be flow happening in that. So it's kind of a different way of protocol they have designed, and they have own copyrights and their own way of teaching that. So I'm telling, so these many things are happening. Different kinds of exercises are happening. It's not like as it is told, the simple push-ups or simple squats. Not those only basic exercises. So there are a lot of wide variety of exercises are available. So we need to
so,
be aware as a physiotherapist.
So can't imagine how would the Indian population would react to animal flow exercises. Like they will
Doing
say,
small exercises itself, it's been hard for us. Making them to do very small exercises, it's hard. Those
yes.
exercises and all, we will be tired. First, we need to learn, and we will be tired of all these stuff. We'll see what will happen. Okay. So the people who told no for exercises, you tried out these things, guys. So don't try to follow simple exercises. Go for swimming or do these kind of different variety of exercises. Surely you will have one template. I'm 100%. I have treated with a lot of patients and lot of steps. We need to find that. That will take some time. You try it out. Surely you will get one exercise which will be comfortable for you, and you will feel very effortless while doing this. You need not need to pick yourself up for that exercise. You feel like a flow. Okay.
So
It's
one
like
more question, like
mm,
according to Indian women's like homemakers, they think that working in a in home is the
mm,
exercise, and some think that walking alone is the exercise. So what do you want to address about that?
working women actually they are a bit different. So they are a bit more emotional, and their problems are a bit complex, not something only physical. So what I prefer and what are the experience of treating with a lot of homemakers and these people know. So they respond very well to relaxation exercises. Respond very well to relaxation and kind of mobility training, not some strength training and all, like mobility training, flexibility training, stretches, and those things and all. They have responded very well. So I would prefer those homemakers at the free time. So they need to do some stretches, like mobility training, these things and all. They can practice. They are not needed for. They are not recommended for strength training and all. So it's not required for do too much strength training like weightlifting. Those stuffs and all not required. Okay, only a simple, like relax exercise. Whatever they are able to do, they can.
And is walking alone is exercise?
Walking is not exercise itself actually. People are thinking walking means I've done some exercise, done some great exercises, I've done some great thing like that. They are telling, especially these old people and all, they will tell. But walking is just an activity. That's it. So it's not a exercise actually. Difference between general exercise, therapeutic exercise. This is one of the important things physiotherapists should understand. So the exercises which you prescribe for general population and the exercises which you prescribe for conditions is different. You should not mix them both. It's very important. I have seen a lot of experienced physiotherapists doing this mistake. Even 10, 15 years experienced therapist and all, I used to uh, directly point out that. So the exercise you give for general exercises should not give to therapeutic conditions. Okay. There are very significant differences in that. This is the importance of the exercise prescription, and the exercise is the only medicine that is given by the physiotherapist. Okay. So electrotherapy, manual therapy has only short-term benefit. See, guys, I have done these courses, right? So I was during when I started to practice, I thought by doing this all those techniques, I can make magic with the patients, and the patient will be cured like anything I have been taught like that. So when I started to practice, I came to know that it's not so, not like that. So electrotherapy, manual therapy, with respect of any kind of manual techniques or like chiropractic technique or HVD techniques, all those things will have only short-term benefits. So I have tried it out. I have wasted a lot of times in that. I'm saying to you, okay. But for that doesn't mean that we should not do that. We should be supporting our real therapy. I mean, the real therapy is exercise. The real therapy is only physical exercise, right? So next point is for long-term benefits, exercise is the only way. Physiotherapy, yeah, this is one of the very important stuffs happening in recent days. Guys, your profession is in danger now. So lot of fitness people, lot of yoga therapists, lot of some other professionals are coming now and taking the reels and putting in Insta, that this and all. Okay, so they are all taking all your clients. All the physiotherapist clients are taken by them. Okay, And I have met with lot of these people, and I would, I would play with them actually. So without knowing all these basic stuffs and all, they will prescribe exercises. I have met lot of people. I would, I just fight with them. I do lot of stuffs with them. Okay, because they are without their professional knowledge, without their basic knowledge, just simply they are giving exercises. Okay, so you need to step up, guys. You need to step up fast. You need to learn exercises. You need to be top in the exercise prescription. Don't let any other profession to get you into. Am I clear?
Yes, sir. True that.
Yeah. Okay. Next point. YouTube, Instagram, LinkedIn previews of exercise, not some. See, what are the YouTube exercises, LinkedIn exercises, Instagram exercises? These stuffs and all just a previews. Okay, we should not completely follow that. We should not completely prescribe to others also. Okay, we should be clear which is good, which is bad, which works, which doesn't works, which harms, which doesn't harms, which benefits the patient, which doesn't benefits the patient. We should have knowledge about that. So the next point, apps AI are supported to the therapist. As I told before, these apps, this AI, this asking exercises for condition in ChatGPT and exercise prescription from the ChatGPT. So all those things are just supportive only. If you can see it out. Okay, don't be completely dependent on that. I'm telling now itself, you will feel a lot of problems when you come in future. Okay, you'll understand later. Okay. Next thing, follow guidelines, articles, and textbooks. Yes, that is the only thing we should do. So always follow the proper guidelines. We have a clinical practice guidelines. We have research articles. We have a meta-analysis, or do a meta-analysis, or do a RCT, and textbooks at the basic levels. Okay. Next point, always have a human touch, which is authentic and real. So always see the patient, treat the patient as well. Yeah. Okay, this is my motto whenever I feel, whenever I treat the patient, I'll have this motto. I think you
I
can understand
think,
this.
sir, this motto should be followed by every physiotherapist.
So we are gonna advance speak about science of physiotherapy. So these things are will be a bit complex. Yes, I'll try to put as much as possible and try to understand whatever you can understand, just understand. And anatomy, biomechanics. So anatomy, biomechanics is the base for exercises. Without those two things, you can't do anything. Without that, no physiotherapy itself is there. Always anatomy, biomechanics, it will be clear. Okay. The next thing is fit principle, frequency, intensity, time, type. So this one of the principle very easy to adapt, and you should have understanding of this. Okay. And the third is principle of exercises. So we have a 10 principles of exercises, which is reversibility principle and adaptability principles. So these principles and all you should be always clear. Okay. And fourth point will be evidence-based practice. So whatever the exercises you prescribe and whatever the things you are giving out to the patient, you should have some kind of evidences in articles, in research, publications, in textbooks. You have. Okay. So not like that you see Google and you should not give that exercise. Research like exercise for low back pain is Google. Some exercises are coming means you should not give that exercises to the patient. Okay. So you should check with the articles. You need to go to the PubMed. You need to type exercises for low back pain. In that article, you should find and like that only you should give exercises. Okay. This Google finding exercise and all patient itself, they sit in their home and they can do. Why they are coming to us, why they are spending money with us. Okay. So don't do that. Next thing is documentation. So even experienced physiotherapists fail to do this. Documentation is very important. So you should know what are the exercises you have to do. Okay. And next thing is follow up and reviews. So this is also important. It's not like that, ma'am, sir, do this exercises and tomorrow, like after 1 week, you come and check like that. You should not tell. So you should always follow up with the exercise. What I call it as art of exercise prescription. So almost a science, a lot of graduates and a lot of MBBs and a lot of PhDs has been done through the science of physiotherapy. But in this art of physiotherapy, it's very, very less studied, very less intervened because of lack of scientific evidences. So any budding professionals can go into this art of physiotherapy. And I learned this art of art from my from my martial arts. So I have applied some principles from the martial arts and I've turned this into art of exercise prescription. Okay. So up to this, whatever I have told you, it is there in the textbooks. It is available. It's already scientific. And this art is something found out after I learned martial arts. And from those principles, I have adapted. Okay. And and I can write it down, give it to you. If you followed all these means, 100% the patient will be recovered, and there will be a complete following up of your exercises. They won't miss your exercises. Okay. So the first thing is creativity and variety. Okay. Don't bore the patient with same exercises, same cat camel, same bridging, same this that. So already they have googled a lot of steps before coming to. So if you do that same, it doesn't work. Okay. Next thing is clinical flexibility. Clinical flexibility is something you should change whatever required for the patient. Okay. Even clinical practice CRP guidelines have given some exercises, so I would reject those exercises also because it's not suitable with the clinical condition. So it's not like that in PKR protocol they have given these kind of exercises on 7th week. I'm gonna do that same at the 7th week of the patient. It doesn't work like that. So we should have flexibility in changing as per requirement of the patient and as per the conditions of the patient for the follow clinical practice. And third point is patient participation. So it's your responsibility to make the patient participate in the exercise. I have heard lots of physiotherapists saying that patient is not doing, sir. Patient not following, sir. Patient only not doing, sir. I have done, sir. They are feeling like that. It's not that so. It is your responsibility to make the patient do. You do whatever you want to do, but the patient should do. That's what I tell to my junior. Okay. Next point is feedback. You should always get the feedback from the patient, which is pre and post. You can take images or you can take a raw score or whatever. Yeah. Next thing is patient education. You should educate the patient for what and why you are doing this exercise. Do like this for 10 times. It doesn't work. You should always educate the patient why you are doing, how you are doing, by doing what are the benefits that you get. You should always have the patient. Okay. Next thing, mentorship with seniors. Okay. So this is one of the important thing I need to tell with the physiotherapist. The students you will do. So it's not like that you got bachelor degree, you got MBT gold medal. It's not like that you know everything. Okay. Don't think that you have a degree. I have known everything. I have a profession. I'm a doctor now. It's not like that. So when you come to clinical practice, the scenario is different. Each patient is different. So each condition is different. So you should always have a mentorship with your seniors or your fellow practitioners or whatever. Okay. Even I'm telling my friend is doing PhD. He also done mistakes in my patient. Even he has done PhD also. Okay. Even PhD also, I'm telling it doesn't work with the patient. When you come with the patient, it's totally different game. All your academics things and all doesn't work here. For that purpose, you should always have a guide, a mentor with the patient. Okay. So next thing is work experiences. You should always learn from your work, from your experiences. Okay. How you treated the patient, you should review it frequently. Okay. So these are the what I call it as art of exercise. One of the common problem, whatever I spoken with a lot of physiotherapists, they are not well organized with the exercises. So they are telling one exercise first, other exercises first. There are some things, some kind of improper organization is present. Next thing is that very unclear regarding what exercises to be done. So for one patient, they will miss one exercises and they will add that exercise later. So there are some confusion in that. And not progressing the exercises. So they will give some pattern of exercises, some fixed exercises, 5 exercises, 6 exercises like that they are giving. You should always progress the exercises to the next level. So next level goes up to strength training, so up to improving the aerobic capacity. So if the same condition comes to means I will leave the patient one day after he run a half marathon. The same low back pain patient will L4, L5 decibels. If the patient comes to me, I'll start the breathing exercises and I will end the patient at the marathon. So at the level of marathon level, I would train them. So we need to progress at the whatever availability of the patient. Okay. Next, the patient is not committing. Yes, it's our responsibility to make the patient to commit to the protocol. Okay, and we should never blame the patients. Okay, so they will be like this only. They will not follow you. They will not listen to you. They will be like this only. You should take all the blame. You should think how we can make them to do, how we can train them to do, how we can motivate them to do. Okay, so for some patient, you need to put music means put music. For some patient require dance means just dance. For some patient needs that means do that. So at last what we need means we need a result, we need a improvement in the range, we need improvement in the strength, we need a reduction in the pain level, we need to improve the quality of life. That's all our goal. For that we can change our strategies how much ever possible and whatever is required the clinical condition. So this is the very simplest thing I have done with the patient prescription. So I have organized all the exercises, whatever exercise available. So I classified all the exercises up to different ways. So I have made into four categories. So first category will be phase one, second category will be phase two, third category phase three, and fourth category will be phase four. So it depends upon the principles of the movement cycles and kinesiology. So I adapted the patient position and what are the effects of the muscles on the patient in the relation to the gravity and what are the things that is happening in relation to the breathing pattern and everything and depends upon the joints and everything. So these are the four classifications I have done. So you can take any exercises in the world, so any exercises for the condition, you can put them in these four boxes. Okay. These are the four boxes. So phase one, you need to phase one exercises, phase two exercises, phase three, and phase four. Phase one will be in lying position. Patient will be in lying. Okay. Phase two will be patient will be in sitting position. Phase three is standing position. And phase four is FM or RTS. FM corresponds to the functional movements. So when the patient started to improve with the phase three, you need to improve them with the functional movements. And for RTS for the sports clients. So RTS it means that return to sports. For sports clients, you need to complete with the return to sports training and at last will be the improvement of their sports performance. Whereas for the normal patient, you need to focus on improvement in their functional movements, like day-to-day activities. Okay. So, for example, like our student Priya told, she told bridging exercises. Yes. So, bridging exercises will come in the phase one, and extension back exercises also comes in the phase one. So core strengthening also will be coming in the phase one. So all those are all phase one exercises. Once you've done that, you need to do with sitting exercises. Sitting exercises instant the patient will be in sitting position. Okay. Sitting position we can give forward bending exercises. We can give thoracic expansion exercises and stretches. You can add thoracic extension exercises. What are the exercises? So it depends upon condition. You can add in sitting position. And after that, you should not complete. So you should progress the patient to phase three. Phase three, where the patient will be in the standing position. So for the same condition, in standing, what are things you can do? You can give balance training, you can give proprioception training. These exercises should add in phase three. So once the patient improved well, you can go with phase four, where improvement will be focused towards the functional movements and functional goal, like lifting heavy objects, like bending forward and taking something, like these kind of functional movements you can improve. Where in case of return to sports will be like for gym patients, those things will be like even doing a deadlift or putting a weights, those things will become under phase four. So once you find what are the exercises required for the patient, you should make a chart like in a simple way like this, and you can add all those exercises so that you can document and you can show the patient also the order and how they are progressing. You can easily find all the things with this simple chart. Right. So this is my take-home message. So be clear with the basics and develop a clinical knowledge and evidence-based collection need to improve and start prescribing with small conditions. Don't start with high symptomatic condition. Very simple condition you can start and document properly and review frequently and feedback. Have a feedback with the patient. Always practice patients with the patient. Yeah, this is my contact. This is I'll answer only with the mail ID.
Sir, any exercise advice you want to give for general population?
So you wake up at early morning, okay, and uh, uh, and you buy milk from the stores. So that is the exercises I'll tell.
Means not to buy online, go and buy,
Right.
right? Like do a
Correct.
physical activity.
Yeah, that's it. One thing is you need to wake up at the morning. Wake up at the early morning, 5 p.m. Go to the store and get the milk from the store. Okay. And while going doing this activity, don't keep phone with you. Okay. So if you do this for 10 days, you'll feel lot of improvement in your life. I have heard from the patient itself. 10 days, do this. Don't take a phone. Wake up at the early morning. Go to store. Buy like this. So if you keep on doing, you can feel a lot of difference in your life. So that is one answer. And for as a physio perspective, as a physiotherapist, what I'm telling means start very simple exercises for the general population. I'm telling, don't see social media, don't hear YouTube's, don't that this, don't do this. Whatever it is coming, you sit and do whatever it's coming for you. Do some stretches, some hand movements, or whatever. See, exercise is not something we are going to teach. It's not something we have found something we are giving to them. Exercise is it's human nature. It's born with human. Okay, even you can sit and simply you can sit and do some hand movements, look up, neck rotate like that. You can do simple. It's in your body. You can simply sit. It's automatically you will feel to move. You'll feel like moving your body that this and that. But the thing is that we are not focused with that thing. That is one problem. Okay. Other one advice I'll give you to young population, play with the kids. Have some kids around you. Go and play with them. Get them to the park. Go and play with them. They themselves will make you play. They themselves will roam you around. Okay. I always have kids with you. Play with them around, and you can do that. Another advice. That's it. Start with simple. That's all. Thank you.
So the book you have published, the Green Book, can you tell us about anything about that? Like what is the book about?
Yes, one. So Green Book actually is uh, kind of artistic book. So I have treated with a lot of patients, right? I've experienced a lot of things with the patients, right? So I sorted out everything and what are the things I found out, what are the things are happening with the patient, and where the treatment are missing, where the problem are happening. So I worked with the AIDS patient, I worked with cancer patient, and I worked with the mentally ill patient like schizophrenia and a lot of psychologically affected patients. So I sorted out everything and made a book. This book is only for the doctors, I mean, who are physicians. I met with a lot of surgeons and all surgeons and the radiologists and these kind of physicians. I also added a lot of importance about physiotherapy. How this physiotherapy will help play a very significant role in the recovery of any kind of illnesses. So for those people, I have written those textbooks.
Okay. So just share the link of your book if it is
Yeah,
available.
you can go on Amazon and can type the Green Book and Sundar.
Okay. So so if
And
any
I would tell kindly don't read the book at this stage. I mean,
Achha.
for the students, those things, kindly focus on your college, kindly, get your degrees, and you try to practice. So after some years of things, when you're bored with physiotherapy, you can see this book. At present, it will be smart advice.
Okay. If anybody have any query, you can ask. Nikhil is asking why strength training is not recommended for homemakers.
For homemakers, okay. So the homemakers, what is happening, they are involved with repetitive activities. So repetitive movements they are keep on doing. Okay. So while doing repetitive movements, what is happening means the muscle are made into. It's not completely recruited. So it is partially recruited in case of repetitive movements. Okay. When you do a movement with very high intensity, the maximum recruitment of muscle will be happening. When you do very intense movement, okay. But when you do very small movement, for example, picking my water bottle, okay, this very small movement. So in this movement, there won't be no maximum recruitment of muscle. So there will be very minimal partial recruitment. So if you do this for 100 times, so this is what homemakers work. They are cleaning their vessels, doing that. This. So this repetitive work, what it creates means uh, it's kind of repetitive activity. The muscle will loses most of its fat in this activities. Okay. So if you see homemakers, mostly they will be lean. Mostly they will be have a lean muscle. They'll have fat, but if you check the muscles, if you palpate these muscles and all, muscle will be mostly lean. So there will be very reduced myosin in their muscle. Okay. So if they do strength training, means 100% they will get injured because of this reason. So I've treated a lot of homemakers doing strength training. And strength training, Nikhil, I want to be clear. Strength training has a lot of classification of strength training. So strength training, the thing I stopping them to do is weightlifting. Taking weights is not recommended. Simple strength training they can do. Okay. So taking more strength training is not advised. Repetitive activities and cause regenerative condition. Okay. So for repetitive activity, you are being taught that you need capacity of the great muscle strength, right? But actually, it is not so. For repetitive activity, you doesn't need that much of muscle strength. Okay, because repetitive activity requires only partial recruitment of muscle. Okay, the muscle strength is required when you load the muscle more than its limit, more than its 1 RM. If you load the muscle only, strength training is required. So strength training is not required for repetitive activities. Okay, how do we prevent or now discuss degenerative conditions? So that's what for reducing the degenerative condition, they can go for some as I told, the flexibility training and stretches they can do. They can do relaxation exercises. They can do they can do swimming and all. Swimming works for them most of the people. And these kind of exercises will work for them for reducing the degenerative conditions.
So Sneha is saying her mom is having diabetes and she complains about fatigue and body pain. So her mom doesn't proceed to do exercises.
Okay, it's needing like consultation. Okay, can you mention your age, Sneha? Age 53. 53 is a bit less only. Okay.
So actually, like 50 plus patients don't do exercises. Like after educating them and after telling them कि ऐसा होगा वैसा होगा, but they don't
Mm.
usually proceed. They want just कि आप आओ और ऐसे ऐसे ठीक कर दो. That's it. So how
We
to
should make them
deal with
do.
that patients?
We should make them to do.
Sorry, sir.
We should only make them to do. You are not getting what I'm telling.
No, sir.
Okay, so uh, so that's what it depends upon patient. First thing, okay. So you should ask why they are not doing. What is their answer?
Due to pain, of course,
Okay, then
and they don't have will to live more and will to move more. Means they are just having the guilt of why it is happening and all. Why me and all that stuff. I guess psychological counseling is also needed there.
hmm, okay. So what I used to do, I'll share you. So when these kind of 50 plus, 60 plus female patients,
We are not
I mean,
able to see you. Like
I'll
your
I'll share you what I would do. Okay, like with this patient. Sneha, you need to consult me ma separately. I need some datas about your mom, like what are the problems. So in general, I mean, in this meeting, we can't discuss those things, these personal things. Okay.
Just
So if
share
you
certain
if you
experience.
need help, you can consult me directly. I'll try to uh, help you as much as possible. Yes. Okay. So coming back to Dr. Payal's question. So always what I do means this geriatric people are then especially this female patient, this those patients only you are telling, right, like 50 plus 60 plus this female patients and all. So I'll
Yes.
make them I'll plan their sessions at the last for the end of my consultation.
Same here, sir.
Yeah, I'll end of my day. I'll make them to come, and I won't prescribe individually. I'll make them as a group actually. So I'll sit at the center in chair. I'll make them a group around them.
But sir,
Okay.
what about home visit? Like home care services में हम कैसे करें?
Home visit is different. Home visit itself is a different topic. So there are different stuffs is happening there. In home visit, we need to do a different approach. We need some different kind of things to do. But in clinics, it is actually easy to make them to do. So always have a group of those people. Don't individually make them to do exercises. So group will be very easy working for those geriatric people. So I tell you, I'll be sitting at the center. There will be around 5 to 10 patients. I mean, sitting across me. So they'll be seated next to each other. So what I'll do, I'll ask one question to my client. Ma'am, you told your daughter went to their hometown. Ma'am, how is she now? Like that, I'll ask one question. So that's all. I'll ask one question. I'll be silent. Okay. So what will happen means, so she'll answer. Okay. And the next client will be there. Now she will tell something. Okay. So hearing that other client, now she will be telling something. So like that, it will be keep on going. Okay. In the meanwhile, I'll just make a clap and come on, raise your hand and come on, do this. Come on, do that. I'll make them to do exercises. And they are doing very happily. They'll be very enjoying. They'll be speaking each other. I'll put some mild music also in video. So they'll be doing very much. They'll be keep on doing. They'll do all kind of exercises. Then I will give jumping, aerobic exercises, strength training, all hard exercises. They do very beautifully and they'll enjoy it so much. Okay, that's how I do.
I tried this music therapy for one patient and I guess it worked.
Surely,
But it
surely.
doesn't work for every patient.
Yeah, it doesn't work. Suitable patient, we should find out. That's what our. So I've been doing like that, and they didn't allow me to close the place itself. They are completely occupied and keep on speaking. So they didn't allow me to go to home itself. It's been around 9:30, 10. So they're still talking and they're not leaving my home. I mean, my clinic. It has been keep on going. So like that only I came to understand. Okay, these patients need some things like that.
So Sneha is asking about how to be consistent. Like she is in corporate company. So how to be consistent with the exercises?
So the first thing is that the exercises what you practice, whether it is suitable for you or not, you should find it out. So you should find out with the physiotherapist. So you have any pain while doing the exercises, you have any problem with the exercises, whether you are comfortable in doing this exercise or not, you should find it out. While doing the exercises, how I'm feeling. Well, I'm starting the exercises and I'm ending the exercises. And between how you are feeling, you are feeling very good, happy, you are enthusiastic or not, you should find it out. If you are enthusiastic, you are feel happy means 100% you will be consistent. So if you are not liking the exercise means that is the reason you won't be consistent. So you
So
should find
basic
out the right exercise.
so basically Sneha consult a physiotherapist and do
Yeah.
your exercise.
Yes. Find with their consultation, find their which exercise would be good for you.
This session
Uh,
was the longest,
Thank
like,
you. I'm also a bit tired.
and very insightful. Thank you for so much for your time, sir.
Yeah.
Thank
All
you
the
all for
participants.
joining.
Yeah. All the participants learn well, and all the best for your future. Special thanks to Dr. Payal. She's putting a lot of efforts behind this. I know editing that, this, arranging this, getting this, that, lot of stuff happening, and we're happy to see this. professionals are doing these things. And I wish you very all the best, Dr. Payal, and
Thank
all the participants, all the best.